balloon sinuplasty and traditional sinus surgery, what's the big difference? What are the major differences?
Well, the balloon is quicker, easier on the patient, and a little more technically challenging for the doctor. But both of them encompass using a scope, which is like a metal stick with a light and a magnifying glass on it, to look for what's wrong in the nose. And once we find these blocked drain sites or ostia, we need to enlarge them. Well, in the traditional FES or traditional way, we take instruments and bite away those holes and bite away tissue to make the hole bigger. With the balloon, it's simply putting a little balloon inside, blowing it up 2 or 3 times, depending on the sinus, and then pulling it back out. Then both of these we go back in with the scope and see what we've done to be sure the orifice is still open. So the balloon is quicker, less trauma, less bleeding, less physiological shifting in the body's reaction. So it's a lot easier and quicker, less packing. So it's just a same benefit or better with less effort.
So statistically, as far as the symptoms going away and coming back, what is better? What gets better results, I guess I'm trying to say.
From the studies so far, at least they are equal, and we think the balloon is a little better on getting long-term relief.
But it's much better on the patient.
Yes. And it may be considerably better because for the length of time, we're not sure yet, because it hasn't been long enough to really know conclusively that it stays open longer than the traditional, just because the studies haven't been done yet.
And this balloon, help me understand. So it goes in like a balloon, the heart procedure?
Like a heart procedure where you have if in your heart you have the artery that's plugged, and by atherosclerosis, you put in a catheter, which is a little wire has a balloon on it, and the sinus balloon is the same thing. And in the heart, it enlarges the artery so more blood flow can get through. In our case, for the sinus, it enlarges the orifice so the sinus can drain better, so you don't have the infection, pain, blockage, and reestablish normal physiology, which is the way it should be.
Now, not a lot of otolaryngologists or E.N.Ts are doing it this way. Is that correct?
More and more are learning and getting on the bandwagon, but it's not many of them yet.
Okay. And in your area, not a lot of people doing it?
I would say not yet.
Okay.
I can't tell you exactly the percentage, but it's few that I talk with who are doing it, especially much. A lot of them are doing it occasionally.
Most insurance covers this?
Most
the new procedure?
Yes. In Georgia, we have one that's not covering it yet. All the rest of them do, because they see the benefit. It's easier for them, cheaper, and it seems the benefits are longer.
So the other way there's cutting, and in this way there's really not cutting?
Correct.
So it's almost like not a surgery. I mean, the way I'm hearing it.
Yes.
Is that right?
It's hard to say if this is a surgery or not. It does do what a surgery is supposed to do, but not using the traditional scalpel or rongeurs or other things that tear the tissue, scar it. So it's definitely less trauma and bleeding and that sort of thing, which we associate with surgery, but it accomplishes the same thing with less pain, less trauma, less bleeding, which is what I would like to have on me and my patients.
You say they could go to work the next day. How soon could they start breathing and be around pollen and not have all the symptoms?
Well, immediately. When they walk out the door, they should feel better. I mean, sometimes there is a little bit of swelling from opening the orifice, but that peaks 3 days, most surgical swelling. But most people tell me the next day they feel a lot better.
So a week later?
Oh, definitely.
They're right there in the pollen?
Yes.
No problem.
Maybe quicker
right?
than that, yes.